talk about the innovation in the treatment of androgenetic alopecia. I will present you a new molecule patented that is called RTF1, and I present the characterization of its main components and the analysis of its biological effects on hair follicles. Okay, I don't talk a lot about androgenetic alopecia because the doctor previously talked about the alopecia. Just I remember you that androgenetic alopecia is the most common type of baldness characterized by progressive hair loss. We have the androgenetic alopecia in the male, that is really the male pattern hair loss, as the androgenetic alopecia in the women that actually is called female pattern hair loss. Okay. The prevalence of the male androgenetic alopecia it represents 95% of all alopecias. Half of Caucasian men suffer androgenetic alopecia in the middle age of the life. Approximately 50% of the men we will suffer in the middle of the life. Okay, but that means that maybe the man is more attractive. Look at this. Really, George Clooney, I think that is better than before. Okay. But, for example, in Indian population, 58% suffer androgenetic alopecia between 30s and 50s. Their presence in the young men provoke really psychological alterations, and almost 95% of older men suffer alopecia, androgenetic alopecia. For example, 30% in the 30s, 40% in the 40s, and 50% in the 50s. In the case of the female pattern hair loss, the prevalence in the population, there are a study in 1,000 patients, Caucasian patients, that demonstrate that the prevalence is just almost 20%. The prevalence is lower in Oriental races. The same is in the male pattern, when you compare with Caucasians, and increases with the age. In the case of the females, 12% in the woman aged in the 30s, 25% the women in the 50s, 41 in the 70s, and more in more age. The presence causes highs, morbidity, psychosocial. Really in the woman is worse than in the man, because the man is more comfortable with the situation than the woman, really. Okay. This is the androgenetic alopecia in the male pattern. We have the different scale, but the very well-known scale is the Norwood-Hamilton scale for the androgenetic alopecia in the man, as the Ludwig scale or the Collins or Sinclair scale for the female. What about the pathogenesis of the androgenetic alopecia? We know very well that in the pathogenesis, the androgens and genetic is very important. Testosterone is converted in dihydrotestosterone, and they are acting in the androgenetic receptor. The androgenic receptor is increased in the cases of androgenetic alopecia. This determines the alteration of the normal hair cycle with shortening of the anagen phase and with the lengthening of the telogen phase, and obviously the miniaturization of the hair follicle. The hair is shorter, thinner, and less pigmented. And provoking these consequences that is the characteristic of the androgenetic alopecia, we have the decrease of the expression of anagen-maintaining factors. This is very important because was detected that insulin growth factor, basic fibroblast growth factor, and vascular endothelial growth factor are the growth factors that maintain the anagen phase. And at the same time, some cytokine, pro-inflammatory cytokines, are increasing, like interleukin-1 alpha, TNF alpha, and TGF beta. This is the treatment that we know very well in the androgenetic alopecia. Really, there are not big news in the androgenetic alopecia. I think that the big news was presented before with the robots, with the transplantation. There are much more news in these cases. But with the topical treatment, there are not very news. The last news that we have is the finasteride, that is a very well-known drug for the alopecia with very well results, but sometimes the patients refuse depending of the side effects that you know very well. Okay, this is the treatment that we have for androgenetic alopecia. Okay, I will present now a new molecule that is the rebuilding transfer factor, is RTF1, and this rebuilding transfer factor is the first secretion of the mammary glands after the delivery, the bovine colostrum. Bovine colostrum. Wow, why the first secretion? Because contain antibodies to protect the newborn against disease, like in a woman. Same. It's lower in fats and higher in proteins than ordinary milk, and it's rich in growth factors. We will see then the composition of this RTF1. And the growth factor like insulin growth factors 1 and 2, platelet derivated growth factor, TGF-beta, epidermal growth factor, fibroblast growth factor, lactoferrin, leptins, and oligoelements. This is naturally in the first secretion of bovine colostrum. Okay, that is very important. That is the first secretion, because in the first secretions you have 100% of the growth factors. But if you take the second secretion, in the second day, the growth factors are diminishing to 26%. That's why it's very important to take it in the first time. Okay. How we obtain this secretion, this factor? We obtain it by extracting according to the control procedures. We analyze, we ultra-freezing, and after ultra-freezing, we crushing in colostrum powder. We defreezing, defatting, and pasteurization. After that, we see the composition of this factor. And the composition is mainly proteins, 73% of proteins. And these proteins means growth factors. And we analyze exactly by electrophoresis, that you can see, this electrophoresis, we can identify that many of the components of this bovine secretion have, we presume that these proteins are growth factors, like epidermal growth factor, like platelet derivated growth factor, the vascular endothelial growth factors. Okay, at least 80 proteins were identified by electrophoresis. Then, of this characterization, we identified by ELISA technique, which is the growth factor that is present in our RTF1 secretion. Okay, and we identified insulin growth factor, transforming growth factor beta 1, platelet derived growth factor B and A, epidermal growth factor, and vascular endothelial growth factor, and another molecules like lactoferrin and transferrin. We analyze this composition, but then the second step is to perform studies, and which is the activity in vitro of this secretion. We tested in cultures of keratinocytes at the first step to try to demonstrate that this secretion preserves the viability of the cells. And we can, there were no statistical differences compared with the control. That means that really preserves the viability of the cells. This is very important because if the cells die, nothing happens, no, with the secretion. Okay, the second step is to demonstrate the activation of growth factor receptors and this pathway signal. This signal, called ERK1 and ERK2, is the extracellular signal that is regulated by kinasas. You know very well that the pathway of kinasas is responsible in the androgenetic alopecia, okay? Following this pathway. In this case, RTF1 increases the level of activation of the epidermal growth factor receptor in dose-dependent manner. We can see here the epidermal growth factor. In the second is that RTF1 increases the level of activation of ERK1/2 in dose-dependent manner. That means that this secretion is activating the pathway of ERK that is responsible for the alopecia, for the hair growth. Okay. This is the comparison between RTF1 and insulin growth factor. You know very well that the insulin growth factor is related with the androgenetic alopecia. And we could see that the comparison is much more strong, the answer that we have with the secretion that with insulin growth factor. The same studies was performed in fibroblasts. We can see that maintain the viability of the cells of the fibroblasts. In fibroblasts 2, increases the level of activation of the pathway ERK, increase the levels of cyclins E1 and E, that is markers of activation of cell cycle, that indicate a positive effect on the fibroblast proliferation. That is inducing the secretion, is inducing the cells proliferation, the skin cells proliferations, to maintaining the growth factor 2. In conclusion, in the human primary keratinocyte and fibroblasts maintain the activation of the epidermal growth factor receptor, and in keratinocytes promote the activation of ERK pathway. In fibroblasts, induce the proliferation of fibroblasts 2. This is another study in vitro that was a proof of concept to evaluate the efficacy of RTF1 in the extension of the anagen phase of human hair follicles through an in vitro test. This method is very well known, that is the Philpott method, and in this case we can see that RTF1 significantly increases the elongation of the hair shaft compared to the standard culture medium used in the Philpott method. This is the Philpott method, and we can take the measurement of the length of the shaft. This is a clinical study. This is the first clinical study performed in 30 healthy volunteers and was a double-blind, single transdermal administration by electroporation. You know very well that you can put the topical solution directly in the scalp. Yes, thank you. In the scalp, or you can use another methods like electroporation. That is like virtual mesotherapy because it's not really injectable mesotherapy. It's by electroporation to enhance the penetration of the solution. In this case, in the males, we can see that the miniaturization was reduced by almost 40%. The diameter increased almost 70%. The pull test was reduced in 73%, and the wash test was reduced in 40%, and the hair density increased by almost 20%. You see the difference with the placebo has been significant. This is the same, the miniaturization reducing, and this is the results in females. Really was a little bit difference, the results in female, that's in the male. The miniaturization in the females, the reduction of miniaturization has been 63%. The diameter increased by 40%. The pull test was reduced in 90%, and the wash test was reduced in 40%. Really very good and significant results. And finally, in the same study, we studied the scalp with confocal microscopy before and after to apply RTF1. And the confocal microscopy images in the volunteers show a significant difference between the active and the placebo group. Because if you can see the size of capillaries is completely different in, maybe I have not battery. Okay, yes, with this. You can see that really the size of the capillaries is completely different and is increased in the case the people treated with RTF1. Probably this effect is due to the vascular endothelial growth factor that is present in the RTF1. Okay. This is the conclusion of this study. Induced significant improvement in all parameters that we tested of the androgenetic alopecia in males and females, and didn't show any adverse events. This is the last study that we performed in Spain and in Italy in a population, in a big population, 90 healthy volunteers with two groups, one active with the RTF1 active solution and the other with placebo during 2 months of treatment, and this is the results. The total number of hairs, the total hair density really increased in significant way in the total hair density treated with RTF1. Okay, we can see here the results that is increasing the density of hair. This is one of the, some of the pictures. Is not finished this study because I take these pictures from last week because recently we finished this study, but you can see the differences before and after the treatment with active secretion, with active lotion. Okay, this is before and after. In the women, we can see very, very dramatic results. You can see before and after the treatment with reveal transfer factor with this active solution. We saw a tendency to be significant in the anagen and telogen ratio, but really is not significant at this level. We just observe a trend. And we observe a significant increase of terminal hair density. And that means that the total hair density that we observe increased with the lotion maybe is with terminal hair, okay? And this is very important because the hair density is increasing by terminal hair, okay? And the conclusions, I'm finishing. RTF1 induces a significant improvement in the global number of hairs after 4 months of treatment and 2 months of follow-up without treatment. That's, I understand that is a short time, okay, to take conclusions because it's just 2 months, but it's important that 2 months without treatment, they maintain the same evolution. This effect is due to the significant increase in the number of terminal hairs. RTF1 shows a trend to increase the percentage anagen telogen after 4 months of treatment, although not reach statistical significance, and doesn't show adverse events. And thank you. Okay.
Question in the back.
Okay.
Doctor, did you have a question? Oh, yeah. That's cool.
These are on the same thing, so together, please.
No? Yes. It looks like a... Hey, hey, hey.